Dr. Atlas, you mentioned minorities would be the first focus of the distribution. How would that exactly work in practice when it's being distributed specifically to minorities? And then secondly, for you,
Well,
Mr.
he didn't say minorities, he said
Well, he
minorities
said the
and
focus.
senior citizens, yeah.
Oh, sure. But can you talk us through a bit more on the focus on distributing to minorities and how that would work?
To clarify, I said that the first prioritization is the high-risk people and frontline healthcare workers. But just to reiterate what I said, there are 51,000 outlets for distribution, for vaccination. And there's over 14,000 federally qualified health centers that are particularly targeted to minority and low-income areas. So that's a focus. I want to point out two other things. We're also prioritizing testing to historically black colleges and universities. And we're in the process of getting that finalized because we know that there's higher morbidity in certain ethnic groups. And the last thing I would say is it's particularly heinous and egregious abuse of the media to instill fear into people about taking a vaccine, because there is no shortcut here. Everything is safe, everything is effective, and for people who have particularly an influence on minority communities to instill fear and doubt is a particularly outrageous abuse of public policy and of leadership. These are people that have higher risk. And so I implore everyone who's in a high risk category that when we get a safe, effective vaccine, they should take the vaccine.